Jai Hind viewers, it's my honor today to host Dr. Kiran Kharat on Achievers Articulate on the Global Strategic and Defense News to discuss the issue of bones being critical for good health. Dr. Kiran Kharat is a leading senior consultant, orthopedic surgeon of India, who is a specialist in primary and revision joint replacement surgery. Welcome, Kiran, to the Achievers Articulate.
Thank you very much, Colonel Sodhi, for having me on your channel. I consider this my privilege, and it's really a great pleasure to be with you. I follow your work very closely, and I'm really proud to be your friend as well. I know of your views on strategic defense, and your voice is not only national, but international as well. I remember you told me you were invited to the UK for some strategic defense analyst forum. And especially in these turbulent times where India is navigating its way through diplomatic relationships, I think your voice and your views are well heard. So congratulations and keep up the good work, Colonel Sodhi. And thank you for having me.
Thank you so much, Kiran. Kiran, the bones are a very important part of a human body. How should one take care of the bones?
Colonel Sodhi, your question is very simple, and and pardon me if my answer is a bit more elaborate. So, with your permission, I will proceed. See, the bones play many roles in the body. It provides structure, it protects organs, it anchors muscles, and it also stores calcium. So, it's important to build strong and healthy bones, and we have only a small time span to do that. So, from childhood till about the age of 30, we have that chance to build bone mass. Because, see, as we speak, every second there's something happening in our body. Constantly, bone is being formed and bone is being resorbed. So, what happens is, till the age of 30, there is what is called as this cycle where the bone formation is faster than bone resorption. So you understand that the peak bone mass is in a 30-year-old adult. Okay. So if the person neglects his health in this time frame, then there is less bone in the bank. And as you grow older, there is going to be more resorption. And the formation cannot keep pace with the resorption. So you heard of terms like osteopenia, osteoporosis. So as we grow older, this has to happen. That's a part of life and the part of aging. But if we prevent that from happening, now it's the time to tell your friends, relatives, or anyone in the young age before 30 to take care of their health and then optimize the bone mass. And then as you grow older, you're much more prepared. You should know what factors affect bone health. So it starts from your diet. So what you eat is very important. The calcium in the diet. So you should know what foods contain calcium. Physical activity is extremely important because people who exercise always do well. Their muscle structure, the fat percentage, and the bone is stronger. Tobacco and alcohol use is detrimental to bone health, not only for bone, but other things as well. And females, by and large, tend to have more of osteopenia. So by being a female, you are at risk for osteopenia and osteoporosis, especially perimenopausal and after menopause. If you're smaller in size, like many individuals are smaller in size and thin, so already you're born with a smaller bone mass. So imagine as you grow older, there is less bone anyway to start with. So the bone bank will be less to start with. Age, as I said, we can't help aging, but we can certainly prevent this from getting worse. Many hormones can also affect bone mass. Like example, too much thyroid hormone, less estrogen, less testosterone can reduce the bone mass. Eating disorders, people who don't eat well, uh, uh, people who have got psychological conditions like anorexia nervosa, those people will lose, bone, especially irritable bowel disease, celiac disease, those patients lose bone. There are certain medications like steroids. So people on long-term steroids, on methotrexate, on anti-epileptic drugs, they can also lose bone. So remember, there are many factors which can affect your bone health. So I recommend at least 1,000 milligrams per day of calcium. And if you're older, 1,200 milligrams per day of calcium. You should know what fruits and foods contain calcium. So dairy products, broccoli, kale, almonds, sardines, and soy, they contain a lot of calcium. And of course, vitamin D is very important because if you have the correct vitamin D, then the calcium is absorbed in the body. There are many patients I know who just take calcium and some just take vitamin D, and it's not going to be useful. The synergy is not there. So you have to have the vitamin D and the calcium in your sort of medication or supplements. So remember, if you are a fish eater, then oily fish is good. Mushrooms, eggs are good. And nowadays, many people fortify the foods with artificial vitamin D. The most important, Colonel Sodhi, is physical activity. And it is imperative that everyone does some form of exercise or other. Resistance training and proper weight training is very, very important to grow bone. Like you are in the army and you know that some astronauts who go, then what will happen is that you will lose bone mass. So these are important things to take care of. So I hope this long sort of elaborate answer um, gives you an idea about how to take care of bones.
Definitely, Kiran, it was very informative and interesting. Thank you so much for explaining it so well. Kiran, what are the latest advancements in the field of orthopedics to cure fractures that happen to the human body?
See, once again, Colonel Sodhi, your question is very small, but the answer is elaborate. So I beg your pardon. And I would like to reframe your question because, orthopedics is one of the most rapidly advancing fields in medicine. And new technology and treatments are coming in, very, very frequently. Fracture care is only a small aspect of orthopedics. So let me answer that question first. Fracture care really came into its own after the AO group, a Swiss-based group, elaborated and developed principles of fracture fixation. They looked at biology, they looked at metallurgy, they devised protocols, and actually, it's like a Bible of fracture care. How to approach a particular bone, how to respect the biology of the bone, and how to use proper implants which will accelerate bone healing. In the olden days we had very bulky, clumsy plates and instruments. Nowadays everything is very anatomic, low profile, using the best of metals and technology. In fact, the specialization has become so much that we've got upper limb surgeons, lower limb surgeons, spine surgeons, trauma surgeons, joint replacement surgeons, and so on. So it's really a fantastic development in the field. In the UK, where I worked for and lived for more than 15 years, I remember a surgeon who was purely a hip trauma surgeon. So all hip fractures went to him when he was on call. In India, that is slowly coming. We have a lot of help in the sort of field of artificial bone. So there is access nowadays to cadaveric bone. There are bone banks available where we actually use the femoral head, elderly people who fracture their hips. Instead of throwing that bone away, we actually bang that bone, freeze it to about -70, -80 degrees. And that frozen allograft bone can be used in very, very complex cases. I must mention 3D printing and technology that has revolutionized, the field of medicine. We have now bioprinted bones and joints available. And we can also actually use bioprinting for metal recreation. So we can have 3D printing technology where we, for example, it's a complex fracture. We do a CT scan and we put that data into the 3D printing, sort of technology where they can print out custom-made plates taking care of the defects. So this can be used in ceramic. It can be used in titanium. In fact, I have personal contacts in Russia where a professor I know is into ceramic small joints, ceramic printing and ceramic manufacture, where we can actually build entire bones, like, for example, the talus and small bones, we can resurface using, proper polished ceramic. In fact, I have initiated dialogue between the Russian and the Indian counterparts to collaborate on this exciting field. Casting is important. You talked about fracture. So in the olden days, we had plaster of Paris casts, but nowadays we've got hybrid casts, fiberglass casts, and even casts where you can have a bath. You can, get wet like normal and nothing's going to happen. There's no maceration inside. Everything dries quickly. Even further innovation is lattice casts. So, these casts are like lattice structures. And what happens is that it molds perfectly, it dries quickly, it's extremely light. You can see the skin through it. So there's no chance of, ignoring blisters or issues inside. And patients are very happy with it. Obviously, they cost a lot. Talking of technology, I must talk about stem cells. There's a big field. It's called biologic orthopedics. There are scientists working on stem cell derived exosomes, where we actually use these stem cells to bridge bone defects. I mean, personally, I have used osteoblasts and chondroblasts. Now, these are small cells in a body. So osteoblasts, it forms new bone, and chondroblasts or chondrocytes actually form new cartilage. So I've used this in special scenarios. For example, what I can do is for AVN case. Now, AVN means avascular necrosis of the hip, which is seen nowadays very commonly because many people in the COVID wave had a lot of steroids, and high dose steroids can cause avascular necrosis. Now, this is a very disabling condition. What happens here is the bone cells die and the femoral head becomes avascular, and it can cause a lot of pain. The patients are young. So if the patients come early, we can actually core out that avascular area and we can inject the osteoblast inside that defect. And imagine that will generate new cell and a new bone. So that is also very exciting. Talking of technology, I must mention navigation and robotics because, a few decades ago, we had navigation where we used that to, properly chart out our joint replacement plan and use it intraoperatively to do a more precise job of, arthroplasty. Nowadays, that has evolved to robotics, and that is playing a very, very important role. Obviously, it's very costly, and it is gradually coming on, in India. In fact, Pune has got 11 robots for joint replacement surgery. It is important in some areas. Obviously, that doesn't mean that you disregard manual, joint replacement, but it's important that the surgeon knows manual joints very well before he gets onto the robotic joint replacement. So precision is definitely there. Obviously, these are big, bulky machines right now. These are robotic arms. Many are guided by the surgeon. So I use the robotic saw and I look at the plan on the computer, and it's a live feedback of what I actually do on the bone. So it's very interesting. In metals also, there is technology, Colonel Sodhi. Initially, we had only steel, but now we've got, alloys of steel, chromium, molybdenum, steel. We've got titanium. We've got, sort of oxenium, which is ceramicized metal. It's like ceramic, and it's extremely strong, durable, and does not wear out. We've got PEEK, polyether ether ketone. These are toxic materials, thermoplastic, and it is very, very good, and it can be used in the body. Many spine surgeons use it in between two vertebral bodies to fuse the vertebrae. It has got inherent anti-inflammation, antibacterial, and osteogenic properties, and a lot of people are using it. We also have biopins, like pins made of special hydroxyapatite and calcium, where we can use those pins to fix bones. So imagine, so if I use a traditional steel, plate and bolt, I will have to remove it after 2 years. But the biopins, I do the fixation and it absorbs in the body after the job is done. So that's fantastic. In infection scenarios, we've got special powders where we can mix the antibiotic for that particular bug in high doses and make granules on the table and inject or implant those granules in the operating wound. So what happens is high dose of antibiotics come out from those granules, and it doesn't cause toxicity to the patient. So you can eradicate infection, and infection is the big no-no in orthopedics. So if it does happen, we have this technology to use. I must also talk, about technology in terms of computer software and programs where we can actually feed the X-ray data and know the size of the implant I'm going to use. For example, in hip replacements, I know which size cup I'm going to use and be prepared in my mind. I must also talk, Colonel Sodhi, about mixed reality systems. We had, virtual reality. Then there is something called as augmented reality. So a mixture of this is mixed reality, where you can get 3D holographic models. And imagine, it's such exciting times here. So in Canada, there's a lot of work going on. And these mixed reality headsets are used to train surgeons on 3D models to get a proper biohaptic feedback of what surgery they're going to do. And then you can do that surgery on a live patient. So right now it is in bioskills labs and in development, but imagine, 10, 20 years down the line, I'm sure it's going to come into surgery. Right now we've got 3D laparoscopic cameras, which give a fantastic vision. Colonel Sodhi, I must also talk about smart implants. I'm aware of certain surgeons, my friends in the US, who tell me about smart implants where the implant, like the knee replacement implant, which is put in the body, can generate data and give me a lot of important data about, the gait and the wear and tear. So it's fantastic. Lastly, I must mention about fast track joint replacement surgery. I remember when I started joint replacement surgery about 30 years ago, people stayed in hospital for 10, even 20 days sometimes. Now, the trend is short stay. There are people who even doing daycare joint replacement. So 1 day, 2 days, or maximum 3 days. And many of my patients, go home that quickly. All thanks to advances in pain management. Now, imagine doing a joint replacement. There's so much bone cutting and sawing and everything, and it's very painful. But with advances in pain management, understanding pain pathways, having good anesthetists who can actually use ultrasound-guided nerve blocks before the patient is given to me, for operation. You won't believe it. The patients are absolutely as pain-free as possible after surgery. They're smiling, and they can walk a few steps immediately after surgery, a few hours after surgery. So that is really, really important, along with drug cocktails, which we use. Like I inject drug cocktails around the cut tissues, plus give the patient some drug tablets before the operation and then after the operation. So all this combines, with excellent soft tissue skills, good implantation, the patient does very well. So there are so many advances, so much to talk about. But thanks for this question.
Well, Kiran, it was really amazingly enlightening and exciting. And now in this, entire advancements that you just talked about, my next question is, where does India stand as on today in the world of orthopedics?
Well, there are no such podium figures, but I can very proudly say that India is looked up to in the world of orthopedics. We've got real fantastic reviews from visiting surgeons who come to India who participate in our conferences, in our workshops. Our Pune knee course, Pune, hip course, and the Indian Society of Hip and Knee Surgeons. There is a constant give and take of foreign faculty coming in. Many operate in our operation theaters. And, there are so many centers all across India. I mean, Pune is itself a great center for orthopedics. And, you name it, and we have got centers of excellence all over our country. And all the foreign faculty, believe me, Colonel Sodhi, are full of praise for our operating staff, for the way we do the surgeries, and the way our systems are in place. So India actually has got a big name, I must say, in world in orthopedics. Yeah.
That was really nice to hear. Kiran, with your permission, I would my final question would be a very personal question. So, I mean, many Indians, when they go abroad, they take citizenships, they work, and very few come back. So, what made you come back to India and serve the country?
Yeah, that's a very personal question indeed. And actually, it's a very emotional question as well, because after spending 15 years in the UK, my thoughts of, coming back automatically germinated in my mind. And, coincidence was that this movie Swades was also going on at that time when these sorts were going on. And my anthem at that time was the A.R. Rahman song, Ye Jo Desh Hai Tera, Swades Hai Tera. So my family, will tell you all about it. So that was going on in my mind. And, I'm the eldest in my family. I decided to come back because, my parents were getting old. I felt I could, give a lot back to my country, to my, my family, my relatives, my friends. And, India was, coming out of its shackles. India was growing. I could see every time when I came to India from UK, the changes happening. And I realized that I won't have to compromise on my surgical skills, because I would have the surgical infrastructure in the form of excellent hospitals where I could, use my skills. I can train a lot of surgeons. I'm a teacher for, postgraduate orthopedic courses. I have done a lot of, surgeries on my close friends, on their fathers, their mothers, my own mother-in-law, my aunts, my relatives, and so on and so forth. Plus, I'm there, as a guiding sort of medical advisor, you can say, because I know various faculties in various departments. I know intimately various hospitals, their workings, their functioning. So invariably, many people ask me, about, hey, Kiran, help me out. You can know about this yourself, because you yourself have asked me, to talk to somebody, who I know, and because my circle is vast. I've been here now in India for more than 15 years. So I'm in orthopedics since 1987. So yes, I'm very proud to be back here. It's an
Well, Kiran, thank you so much, for answering so well, and my salute and respect to you for the human service that you're doing, and you came back to India to serve the motherland. I really have no words to appreciate you, to admire you. Thank you so much for honoring me by coming on the Global Strategic and Defense News.
Colonel Sodhi, once again, thank you very much. And once again, I apologize for my elaborate, long answers to your very short questions. So, I hope you didn't mind that.
Not at all. It was a privilege hearing.
Thank you so much, Colonel Sodhi. Jai Hind.
Jai Hind.